Our next speaker is Professor Avi Schroeder from the Technion. Avi is the president of the Israel Controlled Release Society. He is a member of the Israel Young Academy of Sciences and a member of the Public Council of the Hebrew Language Academy. So Avi is heading the drug delivery laboratory at the Technion, at the chemical engineering. Thank you for coming, Avi.
Thank you, Ronit, and it's really great being here in person and actually having the hybrid meeting where people also from the world are joining in. So thank you to our friends from the world. And this is exciting, especially the talk between clinicians and scientists and trying to improve the treatments of cancer. And I wanted to share with you two short stories that we had, and actually it happened by serendipity. And really the lesson I learned at the end of the day is to listen carefully to our students because they're so wonderful and smart. And it actually began with a review. We were working on, or a revision for our paper in ACS Nano a couple years ago, where we were asked to look at the imaging, or to image the biodistribution of our nanoparticles in mice. We were working on pancreatic cancer. And we decided to expand from what the reviewers asked us and to image the biodistribution also in male and also female mice. And when we began imaging the female mice, we actually saw my students, Asaf Zinger, who's faculty today at Technion, and Maria Polai, who's just completing her PhD studies right now. They actually noticed a very strange biodistribution of the nanoparticles, which I initially thought was to the bladder. And they pointed out that this is not the bladder of the female mice, this is actually the reproductive tract. So we were seeing the uptake of nanoparticles to the reproductive tract of the female mice. And one thing did happen, though, in the animal house that was strange. So when they were changing the cages, they actually mixed the bedding of the male mice and the female mice. And that triggered a cycle of ovulation in the female mice. So in female mice, unlike in humans, the ovulation is triggered by the presence of a male. It's not a timed ovulation cycle as we have in humans. So actually mixing that bedding inside the cages triggered an ovulation cycle, and later we found drove the nanoparticles to a different biodistribution inside the body. So I'll be talking mainly on the biodistribution of mainly 100 nanometer particles, usually lipid-based particles, with either contrast agents or drugs inside of them, and how this actually can be manifested in gender-related nanomedicine and also in the treatment of breast cancer. So Maria Polai and Asaf are here, and they were actually looking at this biodistribution to the reproductive tract during different cycles of the different stages of the menstrual cycle. And when we asked ourselves, can nanotechnology actually, does sex play a role in the biodistribution of nanoparticles? We know sex plays a very important role in the metabolism of different types of medications when we look at small molecule medications. And we asked ourselves, does this also expand to nanotechnology? And the first phenomena we saw is that at the different stages of ovulation, you can see this at the top of your screen, we actually get totally different biodistribution of the nanoparticles to the ovaries and to the uterus of the mice. More specifically, at the peak of ovulation, at the estrous stage of ovulation, we see pronounced accumulation of the nanoparticles in the ovaries and the uterus of the mice, several-fold greater than what we get at the baseline or the estrous stage of the mice. And more than that, in order to make sure that this phenomena is real, instead of using nanoparticles loaded with a contrast agent, we actually replaced the nanoparticles. This is the help of Danny Pearl. We took nanoparticles loaded with messenger RNA, and we injected them intravenously to the mice, and then looked at their biodistribution and their ability to actually express a protein inside the ovaries and the uterus. And you can notice the control is the lower image, and the expression of a protein inside the ovaries and the uterus of the mice after an intravenous injection during the peak of ovulation. So we see we have not only biodistribution, we have also cellular uptake of the nanoparticles and expression of a protein inside the ovary. So this is an image of an ovary, and you can see around the egg follicles, or around the follicles, you can notice the nanoparticles that are actually parked on the surface of the each one of these follicles. They're outside. We don't find them inside the follicles, but they're on the surface. And we wanted to better study this phenomena and understand what actually drives this biodistribution. And as we know, at the peak of ovulation, there's a very rapid angiogenesis that occurs inside the ovaries in order to support the potential of life. And what we assume that through these blood vessels, nanoparticles can extravasate into the ovaries and the uterus and then be taken up, and that's where they'll actually remain after the biodistribution. And in fact, what we saw is that at the peak of ovulation, we see very pronounced increase in the blood vessels around the ovaries and the uterus. And more than that, we asked ourselves, would this actually have an effect on the size of the nanoparticles, meaning that nanoparticles of different size would have the ability or not have the ability to enter the reproductive tract. And we saw the particles that were smaller than 100 nanometers entered the ovaries and the uterus very efficiently, while larger particles, 100 nanometers and above, actually were not very efficient in being taken up into the reproductive tract. And that's important in the design of the nanoparticles in order to make sure that if we want uptake, to keep them in that size, that actually allows the uptake into the reproductive system. And then this can be leveraged actually in two ways. The first way we looked at is, can we improve the treatment of the disease based on this distorted biodistribution? And the disease we chose to treat is ovarian cancer. It's orthotopic ovarian cancer. We created ovarian tumors in the ovary, and then we looked at the efficiency of the treatment while treating with the nanoparticles at the peak of ovulation or at the baseline. And we saw some improvement in the treatment. The tumors were smaller in these mice where we treated at the peak of ovulation because we had higher biodistribution. However, where this effect was more pronounced was in the treatment of breast cancer. So we have an orthotopic breast tumor in the mammary fat pad, and when we treat at the peak of ovulation, we actually lose some of the nanoparticles that we don't find inside the tumor, and we find them actually in the reproductive tract. And there we saw a very significant pronounced difference when we treat the mice at the peak of ovulation. We actually see the tumors grow larger, and the treatment is less efficient because we're losing some of the drug towards other tissues, more specifically towards the reproductive tract. And I think this image that was taken with the help of Rafael Torres Martin Rosales from the UK really emphasizes this biodistribution. You can notice inside this mouse, you can see the breast cancer tumor. You see the uptake of 100 nanometer liposomes. And you can also see, though, the uptake of the nanoparticles in the ovaries and the uterus of these mice. So this, of course, plays a very important role in the biodistribution. And surely if we want to treat the breast cancer tumor, we probably don't want the nanoparticles in the reproductive system. But if we want to treat other diseases, we may take advantage of that. So we wanted to better understand this phenomena, and more specifically, can it also pose some danger to patients, or in this case, that would be undergoing such a treatment. And we looked at the toxicity of a free drug versus a nanoparticle drug inside the ovaries. And what we looked at apoptosis inside the ovaries, and we looked at the apoptotic signal in the egg follicles. And over 24 hours, we saw actually an improvement towards the nanoparticles, meaning that for the nanoparticles, we got less apoptosis inside the ovaries. However, when we continued on to 48 hours, this leveled out between the nanoparticles and the free drug. And the reason is, at least what we think, is that it takes the nanoparticles about 24 hours to reach the ovaries in the uterus, but then once they open up and actually release the drug, we actually get even a more pronounced toxicity inside the ovaries compared to the free drug. And we wanted to test this toxicity aspect. And what we did is we injected mice with either a nanoparticle drug or a free drug. In this case, it's doxorubicin. And we tested their ability to become pregnant again after the treatment. And what we saw is that when we treated the mice with a free drug, actually, after 60 days, approximately 100% of the mice were capable of bearing pups, and also the entire pup population was a live pup population. Having that said, when we went to the nanoparticle group, we saw very different results. So again, it took about 60 days for the mice to be able to become pregnant again, but only 70% of the population, of the pups, were actually viable pups, meaning that we have some also long-term effect here on the mice. And if we dive in, we actually saw this toxicity not only at the litter size and also at the ability to become pregnant again, but also at the ability of or at the damage itself within the ovaries. So I think when we come to construct nanoparticles for treating, we actually have to also call on the aspect of gender, of sex, and possibly also staging of where a patient may be during ovulation. And that study was just accepted this week for publication, and we did it together with Professor Irit Ben Aaron, who's here in the audience, and really a great team of researchers that helped us a lot. I'd like to end with another surprise that we had within our studies, and this is actually the role of neurons inside of breast cancer tumors. And I was not aware that inside tumors we actually have neurons, and it's a rather similar phenomena to the recruitment of blood vessels into tumors. So as we have angiogenesis that calls blood vessels into the tumor itself, it's not surprising to think about it that the tumor also calls neurons into the tumor in order to improve its ability to survive, and possibly also plays a role in metastasis. Maya Kaduri, a PhD student from our group, actually looked at this crosstalk between the neurons and the cancer cells, and she just recently published this paper in Science Advances. And to exemplify this crosstalk between neurons and cancer cells, you can see here on the left-hand side neuron-like cells. These are PC12 cells that are not activated, meaning that no differentiation media was added to the media. On the right-hand side are PC12 cells that are added, or the differentiation media is added to them, meaning different stimuli in order to start activating these neurons. You can see they grow in size and start secreting dendrites. But interestingly, when you take this culture on the left-hand side without any addition, but you do add to it now cancer cells, immediately you see the sprouting of the dendrites from the cancer cells, from the neurons, towards the cancer cells. And this happens from one cell type to another in many of the cell types we tested. And you see it not only in the size of the neurons, also the length of the dendrimers and the number of dendrimers that you get, which would be similar to axons in neurons. And different cytokines are actually being secreted from the cancer cells and from the neurons to support this crosstalk, where the two actually enjoy one another. There's a type of symbiotic effect between the neurons and the cancer cells. And just to see this in front of our eyes, on the bottom are the neuron cells. On the left-hand panel, you can see cancer cells that are grown up from the top. These are triple-negative breast cancer cells, which we got from Ronit's group. And you can notice that the dendrites that are being secreted from the PC12 cells towards the cancer cells immediately as you start growing them in culture. And this happens a lot less when you do the PC12 alone. When we quantified this, we saw that crosstalk happening in front of us. And in fact, it works both ways. It works one way, that the neurons actually enhance cancer cell survival. The neurons themselves, when you take cancer cells and starve them and you add neurons to that culture, the cancer cells survive better in culture. And it's also known that these neurons that infiltrate into the cancer or into the tumor are used later on for metastasis, and that's one of the aspects we tested. When we looked in vivo, first we wanted to make sure that we can find these neurons. There aren't many of them, so we're talking about 3% of the population, cellular population inside, that we could actually detect, and that were neurons. And they reside very close to the blood vessels, so very in close proximity to the angiogenic signals that we have inside of tumors. And more than that, that allowed us to use nanoparticles loaded with an anti-neuronal drug. In this case, we used bupivacaine, which is a pain medication, which we injected intravenously. It reached the neurons and downregulated the neuronal activity inside the tumor. This may also have some implications for treating pain in cancer patients. And we saw very clearly when we start treating the tumors together with bupivacaine inside of liposomes, depending on the dose, we actually get the activity of the drug inside the tumor, and the tumor starts regressing. It's true that bupivacaine can also have activity on the cancer cells themselves, and in our controls actually were there in order to look at the activity on the cancer cells versus the activity on the neurons. Here we're focusing mainly on the activity on the neurons. And when we looked at metastasis, that's where we saw the greatest effect. So when we started treating these tumors together with bupivacaine, and these are breast cancer tumors, we saw a lot less metastasis inside in distant organs such as the lungs, the bone marrow, and the brain. And I think it strengthens recent publications that actually talk about the role of neurons in spreading cancer. So I'll just end here. I'll say first, one of the things we found is that it's important when we come to engineer our nanotechnology drugs to look in the sex aspect or gender aspect in order to better characterize our systems and target them to the patients in a personalized manner. And the second aspect is that as we recruit blood vessels into the tumor, there are other systems that are actually being recruited in, and they possibly may, such as neurons, and they actually may be possible systems for targeting cancer using nanotechnology. Thank you so much, Ronit, for this opportunity today.
Thank you, Avi. Any question? Yes. Just a second.
Thank you. In regards to COVID-19, there are some reports that demonstration is delayed when getting the vaccine of at least Pfizer and the mRNA vaccines. Could the biodistribution you've researched be the reason for that?
So one, we looked at the intravenous administration of the nanoparticles, and that's where we see pronounced accumulation in the ovaries. I also heard those reports. I know they're being looked at in Europe very, very widely. I think one of the things in order to answer such questions is to start talking about it, meaning that when a person gets a treatment, actually staging what stage of ovulation a patient may be or a person may be. I think that's the first way we can better understand how different drugs can be more efficient. Yeah, so I don't know about the vaccine, but I do know that we need to start talking about these aspects in order to improve them.
Yeah. Avi, great talk. Regarding the first part, so Ronit probably knows better than I. VEGF was originally discovered as vascular permeability factor. I wonder whether some of the effects that you see relate to this, and there are many ways how it affects permeability.
Yeah, absolutely. So VEGF increases, also has been used in the past in order to increase the permeability of blood vessels to allow nanoparticles to penetrate different regions. I think one of the big questions we have is if we have VEGF being secreted also in the ovaries and also in the tumor, but both are being secreted, why is one more pronounced than the other? Or are they the same? Or does even one site maybe shut down another site inside the body? I think that's a big question that we have, and it would be great to look at that. Thank you so much for that point.
Hi, great talk. Is there evidence for enriched metastasis in areas where you have more neurons?
Yeah, that's a great question. We know that cancer cells traffic on the neurons in order to reach other sites. But for example, having a neuronal site, would that actually allow metastasis, such as metastasis to the brain? I don't know. That's a great question. I think what we see it here is that the neurons actually use the tumor uses the neurons as a scaffold, one to support itself, improve survival, but also for trafficking to other regions of the body. Surely, I think what it does allow is, just as cancer cells can traffic through the blood vessels, now once they can travel through the nervous system, they actually have totally different access to different regions of the body where they can attack. So it allows another door into different regions in the body. Having neurons ahead of time, I assume that they connect to neurons that are existing neurons, and that's how they traffic to different regions. Meaning that they shortcut to the neurons by secreting factors that actually bring the neuron to the tumor itself, and then once you're in the nervous system, you can reach other regions. Yeah, thank you for that point.
Actually, many of us here in the audience who are looking at the brain tumors are looking into the interactions with astrocytes, microglia, and for sure they promote the metastasis to the brain and also the migration and invasion in the brain. So I assume neurons are another piece of the puzzle that contribute to it. It would be interesting to see this in an innervated tumor like pancreatic cancer. Does it also contribute to sending metastases, not only to attracting them? But that's probably another PhD to do just that. But very nice talk. Thank you.
Thank you, Ronit. Thank you very much. Yes, thank you so much.